It's Matt Roush.
And Mike Brennan.
And we're back with another segment of the M Squared TechCast. We have cleared the second half hour of the show today for an in-depth report on the latest in the coronavirus pandemic from our favorite epidemiologist, Fred Brown of Birmingham. Fred, welcome back to the show for another week. We've seen significant spikes in both the national numbers and in Michigan numbers. And I keep reading now about how this thing is spreading into the least populated parts of the country, which was the last place it had to spread into.
And also impacting our political figures as they move around the country, but we won't go into the politics of it. So,
well, yeah, Mike Pence's office and the political rallies. Okay, sure.
All right. Yeah. So, what's your take on what's happening, Fred?
Well, sadly, we're not in control of the virus. And that's just been the case for a number of months now. And we've talked about that a few times, as the fact that we'd had a few bursts here and there with New York and Texas and California, but that fundamentally the trend is going up. And now we're getting to a point where it's endemic throughout the United States. So there are no real safe areas to go. And so if you're thinking that, you can be up north or be in Montana and avoid the virus, in fact, it's just as dangerous there as it is in our inner cities today.
Yeah, even the UP is reporting a very bad situation up there. And you wouldn't think that because it's so sparsely populated, right?
Yeah, no, it's true. And the challenge with when you get to more sparsely populated areas is their health systems are a lot are actually not as robust as the ones in the inner city. So the further you get away from, the inner cities where they do have ICUs, they do have a lot of ventilator support, they have, people who are ready to be able to separate COVID patients, from the other patients. That's one of the big problems we got in the countryside, is that if you're in a 25-bed hospital out in the country, it's very hard to create a separate ward just for and isolate the COVID patients. And then, spreading among the patients in those places. So it's important that if you do have COVID and you've got bad symptoms, to try to get yourself to a teaching hospital or to a centered hospital that can really help you rapidly.
I guess it's one advantage of living here in Ann Arbor is we've got more medical than you can shake a stick at here, right? So
Ann Arbor's not a bad place to be. If you want to make you want to be in a place.
Between U of M and St. Joe's, man, I'll tell you. Yeah, right, excellent. Yeah.
We have very we're fortunate.
And yet, Fred, I'm still seeing comments on social media. That's always somebody like, well, my sister-in-law's a nurse at Beaumont and she says it's a ghost town. So where are all these cases that they're talking about? So what do you say to something like that?
Yeah, it's so there's some parts of the country that are completely overwhelmed. I mean, if you're in parts of Florida, if you're in parts of South Dakota, if you're in parts of the cities that are, especially the groups that are the states that are really taking off fast, there you'll see overwhelming conditions. So in South Dakota, they're actually having to bus people to Montana. It's that bad, so you don't want to be in that situation. And it's a good thing that it's a ghost town. What they've done is they've actually isolated entire floors at Beaumont, for example, and made those available just to COVID patients. And so what happens is, you're sitting there going, gosh, we got a lot of other patients. Why do we have all these separate beds? And that's because the COVID patients take a long time to heal. We're talking about a length of stay that can be 4 or 5, 15 days, 20 days. Some people are in the hospital 60 days. And so you don't want to be caught, having to care for those patients and having to move those patients if you haven't isolated. And so there are probably parts of Beaumont and I can imagine there are probably parts of larger hospitals that have gotten prepared and then are saying, gosh, we've got this extra capacity, can't we use it? And the answer is, well, you're taking a chance because we're going to have an uptick and you're going to have a lot of patients staying for a long time.
Yeah, and then, of course, we're moving into flu season. So we got the 1-2 punch coming up. The other thing that I wanted to point out, that we talked about this previously, and I'm glad that I did my flying a couple of weeks ago or a week ago.
Yeah, congratulations.
Because on November 1st, all these airlines are going to start filling that center seat in the aisles, and you're going to be shoulder to shoulder with everybody if you're flying somewhere for the holidays. Well, I can only imagine, right? Geez.
Yeah, you're taking a chance. There's no doubt about it. And the more distance you're able to maintain, the better you are. So maybe start flying first class if you can. I know it's very super expensive, but if you're in a if you're got a compromised situation, or you're a compromised patient, I'd recommend probably driving. Interestingly, there's sort of a big business going on with renting mobile homes. So, if you need to go across the country and you want to see the family, bring the whole family with you, you rent the mobile home and you got your whole hotel there, you got everything you need to have, and you drive to, your aunt's, and you're pretty well sequestered that way all the way through the process versus flying out. And then maybe see a little bit of the country, why not?
Yeah, because you have to also wonder about motels, hotels, who's been in that bed the night before and how clean is it, kind of thing. Yeah, that's actually, I hadn't thought of that. That's actually a great way to maybe do that. So,
Yeah, we went and visited. We had a socially distanced 80th birthday party for my father-in-law 2 weekends ago in Benzie County near Traverse City. And it was held in a 40 by 60-foot pole barn with the garage doors open. Thank God it was warm enough that we were able to do that.
It's getting cooler now. Yeah.
Yeah, and everybody was in masks, but what really scared me was the hotel room. But we just brought Lysol and wipes with us and sanitized the hell out of everything when we got there, and did it a couple more times while we were staying there. Plus, it had a window that opened, which was nice.
That's
so,
great.
so you weren't sleeping in one of those bunny suit kind of things, like
Yeah,
All right, good.
I did bring my own pillow though. I will tell you that.
Yeah, bring your own pillow. Absolutely. You have those little silk bags you can slip into if you want to, and you sit on top of the bed. But trick on wiping those things down is to actually get those spray bottles and really soak the surfaces if you can. Those high touch surfaces, especially the clicker of the TV, the on-off switches of the for light switches, all those areas are and the toilets. You want to make sure you probably ventilate as much as you can with a fan and flush.
Yeah, we left the fan on the whole time, and the only problem with leaving the window open was it didn't have a screen, so we had about 9 million ladybugs in the room when we got back. But other than that, so because this time of year they're looking for someplace warm, right? So
Well, it is the season. It is the election season, and I did put something together a few months ago, actually, and I sent it out to both campaigns. I sent it out to the Trump campaign, and I sent it out to, at that point, Biden hadn't even been selected yet. But I thought I'd show you what I thought were the important things to focus upon. I showed you a little bit about the map that we showed and how to, where to try to influence the vote based on COVID policy,
Right.
and that was beneficial to both parties. But my interest is in trying to save lives with improved policy, and so I wanted to show you what I put together a little while ago, and that it has now been picked up by a number of groups, because I was working, as you know, with both Republican and Democratic states, and the Republican and the Democratic governors were saying, it'd be very helpful to have this talked about at the higher level. So this is what I put together. If it's of interest, I can show it to you quick.
Sure, yeah.
Sure.
All right.
Everything you've ever shown us so far has been of interest, so I'm assuming that's going to continue. So go right ahead.
Let me put this onto a slideshow, because I don't want to show you too much of it, because it's actually a very large discussion that a number of people put together. But I thought it was interesting. So basically, this is back a while ago, and I sent this to both campaigns. So I was interested in improved healthcare, and I said, in my experience, the way that we're currently going after COVID is going to result in a challenging situation in the fall. And sure enough, here we are. And I said, in my experience, you can't really control a virus like COVID that's going across the country and spreading like it is with an uncoordinated policy at the national level. Because if you try to do that, what's happened is that everything devolves back to the states, devolves back to municipalities, devolves back to individuals, who then, are responsible for making a decision. And the problem is they'll make individual decisions that might optimize it for themselves, but then when you put it all together, all those decisions start to counteract each other. So we have a whole bunch of states that are, doing one thing, going one direction, a whole bunch of states are going another direction, and they're counteracting what each other are doing. And that's what we're seeing, sadly, in a number of areas in the United States. And so I think I thought there were 7 transitions that were required. The first one is you have an overall U.S. strategy. so that things are fitting into one system. People are communicated to consistently across the whole country, so you're not getting spatters of misunderstanding and confusion all over the country, which I think we were having, and we still have to a large extent, because there's so much data now that's starting to come out. And the other thing you want to have is a standards program that attaches itself to this, to the strategy, so that you can't have, in one state I'm working with, they have, our positivity rate, when it gets over 10%, we want to raise the flag. I work with another state that says, once the positivity rate gets over 2%, I want to raise the flag. Well, that's a big difference in terms. Well, it's a fivefold difference in the trigger that you're using, and so and those states happen to be right next door to each other, with a big city in between them, and they're having a lot of trouble. In one part of the city, where people are driving across and they're infecting the other part of the city, and so it's one state and the other state, and it's a big town. So you want to have an objective scorecard that measures and monitors the state programs, coherent, accurate, is timely. One of the big problems having these data sets come through the states, and it takes this. What happens is, I don't know if you know those curves that we put together at Johns Hopkins, but we have to use 7-day averages. So you see these little spikes all over the place. That has nothing to do with real rates. That has to do with the data that's dumped in, right? So we have to smooth out that curve so that the spikes don't get confusing. Because it turns out that Massachusetts will dump everything on a Saturday morning, their entire last week of work, and now suddenly you got a huge spike in Saturday. Well, that didn't happen on Saturday; it happened the whole week. But so that's why we're using a 7-day average. Some states are quite good. Actually, Massachusetts is quite good, and it actually deposits every day. But there are other states that do. You wait a week every Saturday morning, all of a sudden, boom, you get a hit, and it's very hard to do our models that way, and so on. But at any rate, we don't have timely metrics, so we can't intervene consistently with what's going on the ground. And the other problem is we don't communicate very consistently either. So everyone's sort of wondering what the right levels are, what to do, what to do next, what does that mean? And so that's the first thing I thought was missing. And I've worked with a lot of countries, and all the countries that have been successful have had a national strategy. And and some of these are really strong dictators. Others are huge democracies like India. Others are dictator states in Africa, but they always had someone on top of this that was watching everything that was going on, usually military, actually. So that's what was missing in the United States, and I was concerned about it. So that's one big thing that I pushed early on. The second.
All right. Go ahead, Fred.
Well, keep going. If you have questions, feel free. But the second big thing I was concerned about was the rationing. We are the United States of America. We pay more for our healthcare than anybody else in the world. We have some of the best healthcare in the world, period. And we're rationing masks, pieces of paper that we can't seem to get paper and elastic straps around the back of the head for every person in the country. We were able to, down the street in Willow Run, we were able to manufacture a B-52 every 62 minutes or something, right? In the middle of World War II. What is going on? This is crazy. We can't get enough spray bottles. What? I work with guys all the time who are constrained on their wipes. They can't get the wipes to come through. They can get the chemical. They can't get the wipes to put in, because apparently there are 2 contracts that run the whole thing in the next 2 years, and no one had planned for any additional capacity. So all these things, the rationing of PPE has really been a problem, and you don't really notice it because everyone says, well, I don't really need the mask and this, but you do need the mask. Trust me. If you had better PPE, there's a huge difference, and if in the studies that we've conducted, if you wear a cloth mask, your effective stoppage of the virus is about 83%. Right, so 17% is going to get by. So you're going to have a 17% attack rate after 15 minutes. If you're wearing a surgical mask, that number drops to about 5%. If you're wearing a really N95 well-fitted mask, you're talking about fractions of a percent. The technology makes a huge difference, and the fact that we don't have the best technology for every American out there, and especially the healthcare workers who are now reusing their masks, and that's just unacceptable. And we got 2 companies that basically manufacture all of our masks, and they're sitting fat and happy, but it's killing us. And we have to we really have to start to use the Defense Production Act to tell people like Procter & Gamble, tell people like Kimberly-Clark, who manufacture Pampers every day at this volume, to say, hey, can you start manufacturing some of these masks? Right now, it's 3M and Honeywell that do all of our mass production, and they're small potatoes in the overall scheme of things compared to others countries who are better at this than we are. So the fact that that's the next big thing, the rationing part has to stop.
Well, the other thing now is masks have become political. Unfortunately, one party says wear a mask, and the other party says don't. So I mean, it's a mess.
Well, they haven't said don't, but they haven't been consistent. And that's part. And communication is important here. And they've said, do what you think is right, and we recommend masks, and please watch the CDC, what they have to say. So, they're not quite. At any rate, we just need to get more masks out there. Let's just, that's that much we can agree on. Then we have the insufficient testing, right? We are not testing enough, period, because we're not testing any of the asymptomatic. That's 40% out there. So we can't localize the enemy, right? We can't say, COVID virus is at X% in this neighborhood. We have no idea what the COVID virus is because we're not measuring the asymptomatics. And what you really need to do is you want to test almost everybody who's mobile almost every day, like they do at the White House. You come into the White House, you're going to get a test. And the same thing should be true at your business. Same thing should be true ultimately at your home, so you know what your status really is. And those tests are available, but the FDA doesn't have EUA available for those. They don't have an emergency use authorization available for a home test. They seem to think somehow that the 1,500 or so central labs are somehow going to take care of conducting 40 times the number of tests that they're currently able to conduct. I mean, that's crazy. It's not going to happen. So you actually have to stand up and say, we're going to test every American. Here are your home tests. Start conducting these tests at home and let us know what the answer is, so we know where this virus is and we can go after it. So that's a big piece. And then we're not quarantining at all. And of course, we're so overwhelmed with the number of people who have this thing that we can't do bucketing tests. So sometimes if you get overwhelmed, you can start to collectivize the test. Well, we've got such a high percentage of test positives, we can't do that because it's not efficient as it turns out. And we also can't trace very effectively, because if you have to trace back 2 or 3 generations of contact, and you're talking about 10, 15% positivity rates, almost everybody you talk to is going to say, oh yeah, I've already got the disease. In fact, please contact 30 more people that I may have contacted because I've been under, because I feel under the weather right now. And then you just can't get your control over it. So it's so overwhelming that you just have to test everybody now. You can't screw around with test and track and this and that. It's hard to set up because it's just too late. And then, of course, we have vaccines for America. And we've done a really good job with vaccines and a lot of very good jobs with accelerating medicines. Some of these things have gone faster than I ever dreamed. And it's been remarkable how much these kind of guys have come together. The issue is that we pissed off almost the entire world as a result of the way we did this, because we came in and we said, it's America first, and we're only going to do American vaccines. And so we were stuck with basically the technologies that we had in our American companies. And so that was about 10 big bets that we placed, and they're great companies, but there are 179, people, different vaccines in production. And chances are one of those 179 is probably going to be better than one of the tests that we just happened to be in Pfizer's warehouse, right? And so I shouldn't pick on Pfizer. It was all the big manufacturers that we had, and so we should rejoin the WHO, because otherwise we're not going to be able to test for the future vaccine, right? As soon as you're Pfizer, you say, I've got my test validated and I got it authorized and it's licensed. Thank you very much. I'll just focus on my vaccine. And I know that one down the street is maybe 7 or 8% better, but it's not really in my interest to see that this little company in Germany or wherever gets my market. So they're going to start protecting their market. It's going to be hard for these new little companies to get in, and we'll be stuck with a first generation vaccine that might not be that great unless we rejoin the global community and start to test all these vaccines side by side, comparator to comparator. Because right now the Pfizer tests are different from the Moderna tests. They're using different endpoints. They're using different clinical methodologies, and that's hard to compare apples to apples when you got that. Well, WHO is designed to do that. It actually looks at this test versus that test versus that and picks the best one, period. And of course, then we're using global populations and we can go a lot faster where you have the outbreaks. We may not be in an outbreak. And once we once we test, pass the first vaccine, you're not going to want to go to into a clinical trial where you only get a 50-50 chance of getting a vaccine when one's available out there. So, once we're done with our first test, our first vaccine, excuse me, we're sort of stuck with that generation of vaccine for a long time. Us are able to, to get back into the global community. So we have to do that quick. And then, of course, we have to start to trust some of the politicians. Well, not the politicians. I wouldn't trust what you hear on TV from politicians. Basically, they've all got agendas. I wouldn't trust what you hear from business people much on the TV. I do think that the healthcare, the people who have devoted their lives to public health, devoted their lives to epidemiology, have a PhD and advanced degrees in the space, they generally are pretty objective these days. I haven't seen many people who are off the page in terms of what should be done. Everyone's pretty consistent. If you talk to the guys who I talk to, we're all, there's not very much discussion about whether, what to do at this point. It's all pretty clear. So we need to have data transparency so people understand what the data says and why we're saying these things. And it has to be pretty, and the expert should present a full set of data. It shouldn't be the head of your investment bank saying, we think that this is better than that. It should be a scientist who has access to the data and the complete data set, not sort of slowly releasing data that's helps their stock price, which is what we're seeing a lot right now. And we have to recruit a lot of new leaders in some of our institutions, sadly, especially the CDC really let us down. And that was happening already in May when I wrote this, unfortunately. Then we have we have a really fractured health infrastructure. We've always had that problem, right? Everyone goes to slightly different areas, and so and we don't have anything that's really designed for pandemic outbreak. We're pretty good at maintaining. If you got a pathogen that's in control like the flu or in control like pneumonia, and don't have a big outbreak, our existing infrastructure is pretty good for that. But where we're falling down with COVID is we got to have a fast infrastructure right now that's ready for outbreaks, ready all over the country simultaneously, ready to go, and we don't have that kind of infrastructure. So that has to be redone, especially with real-time testing, real-time capabilities. We have to have earlier detection systems, earlier testing and quarantining, and then we have to be able to rapidly flex the infrastructure to be ready for a pandemic, because this is not going to be our first pandemic, right? We're going to have another one. I mean, we had 1,371 epidemics breaking out in different parts of the world since 2007. So the chance that we, aren't going to get another pandemic like this in the next 10 years is really low. So any investment we make right now is going to pay off. And then the last point is, right now we're being, forced into, it's going to be either health or the economy. You can choose either one or the other. And the truth is that, if you think about the interventions we got, which is PPE and mask wearing, you don't have to shut down the economy to do that. You can wear a mask and still, pay a credit card bill or go out and shop. That's possible to do. And so it's not that we have to choose between one or the other. And in fact, if we don't get this health thing under control, we're never going to get our economy back again. So you got to get the health thing back under control, and then you can move forward in the economy. And it's not really a stimulus package. I keep talking about the stimulus package, this and that. Right. It's not. We're just trying to be able to mothball what we got to preserve it, so that when the thing does pass through, and we think that's probably going to be another 18 months, sadly, and it's probably going to cost us $6 trillion a year to pay for this. But it's better than shutting everything down and having lots of deaths. That's for sure. Which happens when you're out of control in a pandemic. So that's what we need to get to.
We've got about...
I don't think you have to get political, because when it comes to that column on the right,
yeah,
we are doing exactly none of those things now.
That's sad. That's so
so
depressing to me. Exactly. I know. We can't seem to pass the fiscal stimulus in the Congress. I just can't believe that. I mean, I don't know what the heck they're waiting for. You talk to, well, I know what's happening. So what part of the issue is that there's some people who are saying, look at the stock market. It's a V-shaped recovery. We went down, we're coming back up again. So we don't need any of the stimulus stuff. If we stimulate, we're going to have inflation. Well, that's the stock market. The real economy isn't doing that. And if you talk to literally any economist on the planet, they're going to tell you, no, you need to put some money into that economy, or you're going to have permanent disruption and permanent scarring to your economy, because you're going to have to restart it somehow, and or you can just preserve it as it is. And
Well, you could pay now or pay later is more or less the situation, right?
And you pay a lot more later, trust me, because I've had to
Yeah.
rebuild economies after a pandemic's gone through, and it's you start from nothing. And right now we're starting from a lot, right? So we got $21 trillion to work with. So let's not ruin that.
Well, and it strikes me that the countries that have gotten this really under control, I mean, yes, they're smaller than us, they're more homogenous than us, but it seems like the key to this thing has been widespread testing, like testing, and then contact tracing of people who either have it or have been exposed, and then a strict quarantine for those people who either have it or have been exposed, with financial compensation to get them through that time of quarantine. They figure out, okay, you've been exposed, but you're not going to get it. So here's 3 weeks pay. I mean, is that really that hard to do? I don't think so. And it seems like those are the countries that really have it under control, have done those three things.
And China's actually going to grow 2% this year on GDP. They're the only economy that's going to make that happen, but they're actually going to grow 2% this year. And so this is not rocket science. It is basic, blocking and tackling of health, of public health. And we just stumbled early on, and then we never really caught up. We stumbled with the testing early on. We never got in front of the virus, and and since then we've just had a challenge. And we also have miscategorized it. We kept putting it in the flu bucket, and it just isn't the flu. And so all the people who we had with expertise in the CDC and said they put it in that center of the CDC, and that just wasn't appropriate. We had a much higher death rate, much higher transmission rates. It wasn't seasonal, didn't have a vaccine attached. I mean, there are a whole bunch of problems with the way we assigned the authority for this.
We have about 2 minutes left. What
Sure.
can we say in the final 2 minutes?
Be careful. It's starting. What I said a couple weeks ago. If you want to do some stuff, do it this week. Don't wait until November. Well, it's November now, and just be really careful, because this thing is out there. It's looking for kindling, and if you're just let your guard down a little bit, it's going to find you, and it may not hurt you, but it will go through your family fast. I mean, we're talking about, if you're married, 76% attack rate. If you've got kids, 26% attack rate. And generally it moves from children. Now we're seeing after about a 2-week period to the adults, and then sadly in about 3 weeks to the next generation, which is the grandparents and older people.
And rethink those holiday parties.
Please,
Probably a very bad idea, right?
Yeah, I mean, my wife and we usually have 40 people come to dinner for Thanksgiving. This year it's just her and I and the dog. Yeah, we got a 36-pound turkey, so we'll send some out after.
That'll make the dog happy, right? So,
Yeah, right.
The dog will have a field
Plenty
day.
of leftovers for the dog in the freezer. That's right.
so
4-year students love Lawrence Technological University's thriving campus life. But LTU has always met non-traditional students' needs too. Lawrence Tech offers over 100 degree and certificate programs that can get adult students started or back on track. And most of our classes are conveniently offered evenings at our beautiful Southfield campus or online, so you can balance your social, family, and work life even while you power up your career. Lawrence Tech, where Blue Devils dare.